Good morning. Hello and welcome to the penultimate episode of our Workflows webinar series. This week's focus is on our mental health workflows. My colleague and one of Osprey's case management developers, Alex, will take you through the what, whys, hows of workflows, looking at how implementing the time-saving automations can help ease the pressures of your workload, increase efficiencies, improve productivity, and enhance your client service. Before I hand over to Alex, I just want to let you know that the Q&A feature is open at the bottom of your Zoom screen. If you have any questions, please post them in there and we'll try to get around to answering them at the end of the webinar. If we don't have time, one of the support team will get back to you. So without any further delay, I'll hand over to Alex to begin.
Thanks, Amy. Yep, so I'm here today to talk about our mental health workflow. I actually did a short span in mental health on my training contract, so I have a little bit of knowledge about it. And the mental health workflow is really to capture your clients' details, details of the hospital that they're detained at, if they are indeed detained, and just issue with some template letters that allow you to advise your clients a little bit easier. Obviously, we know that it's an area that can kind of, it's not really a straightforward procedure as such. So what we've done is tried to incorporate lots of templates that can help you with general advice. Of course, the purpose of a workflow is to take the user through a whole matter if possible. It's not quite so appropriate here, but what we try to do is capture third-party and matter-specific details to populate documents with. We can allow you to record important deadlines, and we can make sure what we can is as automated and efficient as possible for you. Something that we use quite a lot in workflows is our single data entry. And that's done by questionnaires. So questionnaires allow you to enter data against the matter, and you can see here that we've taken some information about our client. We've got a surname at birth. Obviously, you'll be familiar with that from the legal aid forms. All sorts of other bits and pieces, the mental health tribunal, the hospital that they're detained at, and so on. So using these custom questionnaires, we can capture your client's data and details, and this can all be used to pull through into template letters, which we can run. So what do we have then available? Here's our workflow file opening task. I'm just showing you this questionnaire that I had a screenshot of before being run through the workflow. You can see when you've clicked on it and you submitted the information, it's saved, and now that task has shown up as green to confirm that it's been completed. So that's really simple. You can see how quick and easy it is to use a workflow through the app. So going on to document production then, now that you've run your questionnaire, you've run your task, what can you do with that information? So here we've got a client care letter. This is showing advice for a client detained under Section 2. We do also offer advice for other scenarios, so Section 3 and so on, CTOs. That will pull through into the client care letter is determined using criteria. So in the first set of custom questionnaires, you'll be asked what type of matter it is. You'll select, say, Section 2, as we've done here, and that will pull through the relevant information to the client care letter for you. So there shouldn't, in theory, be anything that you need to do other than perhaps add some more instructions that your client has given you. In terms of what we have available, then we do have other template letters available. So, for example, we've got some basic advice for the nearest relative, if that's appropriate to your matter. We've included the forms like the notice of acting, so you can really quickly and easily prepare that and send that off. Brief to counsel, templates notifying the client of their tribunal date and so on. Although some of them are short letters, they do make it a lot quicker for you to get that documentation sent to your client. You just need to input the tribunal date and off your letter goes. There's no long typing, just makes it a little bit quicker and easier for you. So something else that I'd like to mention is our time recording app. Here I've got a screenshot, a couple of screenshots of the time recording app being used on the mobile phone. So you can use it wherever you are, either on your mobile when you're out and about, as I've displayed here, or you can use it on your computer. So your computer or laptop, there's a desktop version of it. What we've also done is set up the legal aid remuneration rates within Osprey. They're maintained by us, and we only ever change them when the legal aid agency tell us that they've changed. So you can be confident that you're accurately time recording for every unit that you enter. And as you can see here on the time recording screenshots, the app is giving you the total for today. So Dave has recorded 54 units, equating to a total of £675. Within that time recording app, when you log in, that's the kind of overview that you'll see. So it's a quick snapshot of what you've done in the day. And you can see you've got your typical time recording options here. So you've got viewing your time ledger for any of your matters. You can post time and you can start a timer. So looking at the timer here on the right hand side, you can see here that 1 minute so far has been elapsed, but obviously you can use that timer for meetings. So you want to time how long your meeting is with your client. If you've got a phone call, you can start a timer for it, and you can post and add an attendance note if you want. And the benefit of that is that you can use that when you're out and about. So you can time your journey to meet your client, you can time your attendance with your client and so on. So that's really helpful. And of course, you're wanting to time record as accurately as possible. So that's just going to make it a little bit easier for you to do so. Something else that we can do through their app and through workflows in general is record key dates. So of course, it's really important to add key dates to remind you of things like your tribunal upcoming, getting prepared if you need to instruct counsel, doing that well in advance and so on. We have a web portal that's probably not going to be applicable really to mental health clients, but if they are wanting to use the web portal, they can, and you can publish documents and key dates to the web portal. If you want to learn more about that, then please do get in contact with us. But like I say, it probably won't be very appropriate here for clients that are detained and so on. So really, these key dates are going to be a good reminder for you internally. You can have them through the app, as I've displayed here with the screenshot, but you can also link up your Outlook if you have an Outlook 365 account, and they'll display in your Outlook calendar as well. If you're also an Excel accredited firm, that covers you off on having your key dates saved in 2 separate places. So in terms of customizing the workflow, it's really easy to do so. We can assist you with that, and you can add in or remove anything that you want. So if you have additional steps that you'd like to include in your workflow, you're welcome to do that yourself once it's been imported. And then in terms of how we kind of keep our workflows updated and how we deal with imports, we have something called the sync tool. That's a relatively new function that we developed. The purpose of it is to allow us to push updates of workflows to our clients, but it won't overwrite any changes that you've made themselves. So sometimes we find that people want to use their own client care letter because they've had it vetted by their kind of compliance officer or whoever has looked at it, and they want to use that specific version. You can be confident that when we upload a newer version of our workflow to your site, it won't overwrite those changes. So it's built into the coding of it that it will check within the Word documents to see whether anything's changed, and it will retain your changes. We're currently the only legal software providers to do this, so that's quite a nice function. In terms of how we keep up to date, we've got a team of people working on research and development. We're creating new workflows, and we're also updating our current workflows as well. So that goes for all of the other bits and pieces that we offer, family and so on. And in terms of importing workflows, again, really simple. All you need to do is get in touch with our support team. They can import a workflow within a matter of minutes. So they would usually schedule it as an overnight import. It will start at 6 o'clock in the evening, and it will be done by the time you start work in the morning. So effectively, you can get up and running with the workflow straight away. So that was a nice, quick and simple workflow, just giving you some information about the mental health bits and pieces we offer. So I'll hand back over to Amy for any questions we've had.
Hiya, thanks, Alex. So we'll go through a couple of questions. The first one is, I haven't used the app before. Can I get training on it?
You can. So what I've referred to in here is the time recording app, but I've also taken screenshots from our main case management app as well. Those apps are both available through iOS and your iPhone and Android, but also through the Microsoft Store. So really easy to set up and to download. You can have full training, and that includes help with downloading them if you're unsure how to do that. So all you need to do is contact our support team. The information for that is on screen now. You can either ring or email, and we can set up some training for you. All of the remote training is included within your license, so there's no additional cost. You can have it for as many or as few staff as you want, and it can sort of be customized to how you're going to use it as well if needed.
Perfect, thank you. We have some templates, but would like to add additional ones to the ones you've provided. Can we do this?
Yes, you can. So that's a really simple case of just adding a new template to the work type and therefore to the workflow. So again, really quick and simple. And we'd be more than happy to help. We offer training and we also offer support. So again, just get in touch with our support team, tell them that you want to add a new template and they'll be able to talk you through the steps to do that.
Thank you. And I think we've already touched on it, but I'll say the question anyway. How can we get the workflow if we wanted to implement it?
Yeah, so as I said, it is literally just a case of speaking to our support team. What they can also do, which I didn't mention, is take you through the workflow in a bit more detail. So they can really go through all of the actions within the task. They can show you all of the templates through a little meeting session. What we also have is on our support academy, that's a kind of academy website. We've got all the workflow packs for all of our workflows, so not just mental health, but everything that we offer is contained on that website. And in the workflow pack, you can see in detail every single step of a workflow, including the templates. So you can look at all of the advice in the templates, the letters and forms and things are enclosed, the criteria set against documents and so on. So literally everything is there and you can review that before you have the workflow imported if you want to.
Perfect. Thank you very much. That answers all the questions for today. So I just want to say thank you for everybody for joining and thank you to Alex for your presentation. We do have another workflow webinar in our series next week. That's on our debt recovery workflows. That will be our last one for the workflow series at this present time. If you've missed any of the previous workflows, you can find them all on demand on the Academy. So thank you all for joining and we'll see you next week.
Thank you.